Hi, everybody. I'm Maria Goodman, a licensed midwife, mama of 3, and the founder of PregnantTogether, which is an awesome membership community for pregnant people. On this channel, I provide you with the information you need to thrive during your pregnancy. So as a home birth midwife, during interviews with potential clients, one of the most common questions I get asked is what happens in an emergency during a home birth? This is a super important question, especially when you're considering whether or not home birth is for you. Let's dive in. So number 1, pre-screening. A really important part of this answer is that home birth and out-of-hospital birth in general is really only safe for low-risk birthing people. So that means that people don't have any pre-existing health conditions like high blood pressure or uncontrolled diabetes, and babies that, as far as we know, are low risk as well, with no genetic or anatomical differences that may cause them to struggle to transition after they're born. This isn't a one-time process either. As midwives, we are constantly screening our clients in prenatal appointments as well as during labor and the postpartum period, and helping to make sure that birthing people remain low risk. We check their blood pressure, listen to the baby with a handheld Doppler, and do tons of other assessments to make sure that everything remains low risk during the birth process. So 2, if people become high risk, we transfer care. A huge focus of our training as home birth midwives is learning how to identify if and when someone becomes higher risk. I like to say that I'm looking for pink flags, not red flags. This means that during the pregnancy, birth, and postpartum, I'm aware of anything that veers outside of the realm of normal, and I'm constantly assessing the whole picture to see if somebody remains a safe candidate for home birth. If these pink flags start to turn red and it seems like the person is moving towards being high risk, or if there are a lot of pink flags at the same time, I have a conversation with my clients to explain the whole situation and discuss transferring to the hospital. Midwives are trained to understand when to transfer to another care provider and move the birth to a hospital where people have access to some more complex technology that may be needed in situations where people are experiencing a higher level of risk. I like to say that it's not home birth at any cost. We only stay home if everything remains low risk. 3, midwives are trained to handle emergencies. So all of this said, as home birth midwives, we are trained to handle emergencies if they do come up. The 2 most common emergencies in a home birth situation are babies who need some help transitioning and learning to breathe, and birthing people bleeding too much after the birth. Let's talk about each of these in more detail. So during pregnancy, babies are in a water environment and their lungs are full of fluid because they're receiving oxygen through the umbilical cord that connects them to the placenta that's attached to the birthing person's uterine wall. So you can see the placenta's here. You can imagine that the uterus is surrounding it. And then if you can imagine, this is the amniotic sac and the baby is all curled up inside, connected to the umbilical cord, usually with their heads down. So during birth, the baby's lungs are squeezed and the fluid comes out. And then they start to breathe when the pressure of the air changes and it stimulates a reflex in them to help them open up their lungs. Sometimes babies need a little help with that process. And so in that case, we use this kind of equipment to help them clear the fluid from their lungs. So it would look something like this, with the baby on a firm surface. I know that this may look scary, and it can be, but it truly works really well to help babies come around. We're basically doing the work of pushing out that extra fluid of their lungs and supporting them to breathe until they can do it for themselves. Also, in home birth, we always keep the umbilical cord intact so that the baby is still receiving healthy oxygenated blood through the placenta. So the second most common complication is birthing people bleeding too much after the birth, aka postpartum hemorrhage. Home birth midwives carry medications to handle hemorrhage, the same ones that they use in the hospital, and we use them in the same way. These medications include Pitocin, Methergin, and Misoprostol. We also have IV supplies that we will use if somebody loses too much blood and needs some extra fluids. These medications work extremely well, and I would say as home birth midwives, we're extra cautious about bleeding Since we're not in a hospital and we want to make sure that people feel good after giving birth and aren't too anemic or just feeling crappy after birth. In situations where the bleeding is not too extreme, we may also use herbs. And two of the herbs that I use are Yunan Baiyao, which is a Chinese herb that works so well at stopping blood. And Angelica is another herb that's great for helping the body release the placenta. I actually experienced a postpartum hemorrhage after I gave birth because I had a long labor and my uterus was tired after the baby was born. So it didn't contract down effectively enough to release my placenta without causing too much bleeding. My midwives used Pitocin to control the bleeding, and it's just a little shot in the thigh that's really nothing compared to giving birth, and it worked so well to stop the hemorrhage. So if you're considering home birth, there may be other things to think about as well that are more specific concerns. If you want to learn more, you can check out this video about how midwives are trained in the US.